Hey guys, Dr. Megan Faulkner here with Apex Sports Medicine, and today I'm going to show you how I use the T-tool to treat the lateral hip. So that's going to include the TFL, the glute med, and maybe a little bit of that piriformis. So we're working clothed because I just find that's easier in my clinic because we're moving a ton. I'm going to actually hold on to the wide flat edge because I feel like I get a really good grip and really good control of the tool. And then I'm going to start, so here we have our greater trochanter, and I'm going to fan out on all this musculature here in the lateral hip, and that's what I'm going to be working on today. So first, I'm just going to start working through TFL, and I'm just going to do some gliding. And I'm also assessing while I'm gliding, so I can feel through the tool and through the, so right here we have a little bit of tightness, but I can actually feel when we get a little increased density, I can feel that bump up against the T-tool, and I know that that's an area that maybe I could spend a little extra time on. So I'm just kind of scanning through the muscles to see what maybe needs a little extra treatment today. So we found a little spot right here. So now what I'm going to do is switch into a little bit more of a pin and stretch type treatment. And since this right here is going to be our glute med muscle, we know that it's going to do hip abduction. So we're going to actually have the knees stay together, and the patient's going to draw the heels stay together, and the knee is going to draw up. And I'm going to find that tissue that we found was tight earlier. I'm going to be able to pin it down here, and the patient is going to lengthen that muscle by drawing the knees together into adduction, and I'm going to be holding and doing pin and stretch right here specifically on that muscle that's tight. I'm going to pick up, I'm going to have the patient bring the knee up, I'm going to move down or along this muscle tissue, I'm going to pin that down again, and she's going to draw her knee down into adduction, creating a stretch or lengthening that glute med muscle. We're going to do one more, bring that knee up, and we're going to pin that down. Again, treat the entire length of that muscle, pin that down, and draw the knee in. Cool. So that's how I treat the lateral hip using the T-tool.